Good evening. My name is Angelica Vecca, and I'll be speaking to you tonight about the connection between Western medicine and culture. It's extremely important when we talk about Western medicine, especially nowadays, that Western medicine especially is considered the creme de la creme of medicine around the world. It's especially important when we talk about exporting Western medical ideas to other countries and Western medicine techniques and practices to other countries, that we really take into consideration the cultures of the countries that that these practices and techniques will be utilized in. And why is this important, you may ask? Well, it's extremely important because no disease exists outside of the individual that it affects. And no individual can exist outside of their culture. So what does this all mean? If I were to get sick and I were to go to the doctor, the vocabulary that I use to describe what's happening to me, how I'm experiencing my disease, is informed by the culture that I grew up in. So I grew up in the United States. I'm informed already by Western medical ideas. So if I go to the doctor and to communicate my symptoms, I'm already speaking in the language of Western medicine. So it's easier for the doctor to communicate with me, to understand what I'm describing, and to then, continue with the exam or to diagnose me. Now, this isn't always the case. And we're not talking about we're not talking about how the extra layers added when you have to work through an interpreter who's looking to find the right words and the right expressions. We're just talking as if this person comes from another country completely, but they've been touched by they have the tongue of Babel, and they're able to speak every language in the world perfectly. So they come to a Western medicine doctor and they start to describe their symptoms. All right, so now the descriptions and the language that they use to describe what they're experiencing, what's happening in their own body, their experience of their disease, is going to be extremely informed by the culture that they come from the area that they come from. I mean, I've seen people describe, that sensation when your leg falls asleep as having ants crawling in their legs, or they feel like they have boiling water moving through their veins. And these are all expressions and ideas that are heavily informed by our culture. If I were to go to a doctor and I were to describe to him, a tingling sensation in my leg, I would say, "Doctor, I have a tingling sensation in my leg." But you have other people who don't have that same language. It's not a part of their culture. It's not a part of their vocabulary. So they go to the doctor and they say, "I feel like I have ants crawling up and down my leg, or moving on the inside of my leg, or I feel like I have hot water running through my veins." And they use different ways. They have different ways of communicating what they're feeling. So it's important for doctors to sort of understand and have an idea and have a respect and an open-mindedness towards the culture, towards their patients' cultures when they're treating the patient. And this is especially important when we talk about understanding the disease itself. I myself witnessed a woman from a Spanish-speaking country come into her clinic to speak to her doctor, and she kept insisting to the doctor that she had, when he was asking for her medical history, that she had contracted chikungunya. And now the doctor had no idea what that was. Neither did the nurse, neither did the interpreter. And the interpreter was interpreting in Spanish, but chikungunya was something that they had never heard of. So I watched as the doctor laughed and kind of brushed off this very important fact that this woman was very visibly very upset and very insistent and very concerned that the doctor understand that she had been diagnosed with chikungunya a few years back, and ever since that diagnosis she hadn't felt the same. But because the doctor was unaware of her culture and had no idea what chikungunya was, and because chikungunya is not a Western medical disease, he laughed it off and sort of brushed her concerns under the rug and really wasn't taking her seriously, until finally the interpreter, who was very uncomfortable by the fact that she was unable to translate this term chikungunya, she was very upset she couldn't translate it. So she left the room she didn't leave the room. The doctor and the nurses told her, okay, we'll be right back. And they left the room. And as the doctor and the nurse laughed between themselves about this crazy chikungunya, what the heck is that? The interpreter walked over to the computer and started searching for the term, very upset by the fact that she hadn't been able to translate it. And it turns out that chikungunya was a condition that had been written about in medical journals most recently, because there had been a very big outbreak in the Dominican Republic of chikungunya, which is something similar to malaria, and it's transmitted by mosquitoes. And because both the doctor and the nurse were unfamiliar with the cultural background of the patient, and they were unfamiliar with the culture, they were unfamiliar with the country, and they were unfamiliar with the disease, they almost missed a crucial part of her diagnosis by laughing and brushing it under the rug and saying that, she's crazy, she's silly, she's using this, this is a folk condition. This is, from people from the campo, people from the countryside who believe, they make up their own diseases, they make up their own explanations of what they have. This is obviously some kind of country disease, and they sort of just laughed it off, and they almost missed a critical part of her diagnosis. If it hadn't been for the interpreter, who was very upset by her inability to translate this term, and who was very determined to figure out what it could be, if it hadn't been for the interpreter and her initiative in looking up the term, the doctors and the nurse would never have understood what chikungunya was. And, thankfully, it wasn't a very serious situation, and they were able to figure out what she was talking about, and they were able to treat her, and everything worked out in the end. But, this was not the first time, and it won't be the last time that, a patient is misunderstood or is maybe even possibly mistreated because of a cultural aspect that she's unable to communicate to the doctor, or that the doctor is unable to understand. So it's very important that even if the patient isn't making any sense, or even if maybe the doctor doesn't really know what the patient is trying to communicate, it's very important to sort of keep an open mind and try to understand and try to be culturally aware and culturally sensitive when working with patients. This even translates into the treatment of the disease that the patient may have. For example, after the earthquake in Japan, the Western medicine shipped out a whole bunch of psychiatrists and a whole bunch of medical personnel, anticipating, oh my gosh, they had an earthquake. This is a national disaster. They're going to have so many cases of PTSD. So they shipped out medical professional, and they shipped out psychiatrists in order to reinforce the medical, the medical staff of the country. And when they got there, their treatment methods, because they were working in a new country under a culture that they didn't really understand, they were imposing their Western medicine treatment methods of how PTSD is supposed to be treated onto people from a culture where these treatment methods were actually extremely traumatizing. Japanese men and women are not accustomed to talking about really personal information, and especially not in groups. And we're talking about treating PTSD victims in a group therapy setting. So you have Western medicine professionals telling Japanese people who really do not have that, they're not familiar with that way of expressing, they're not familiar with, and they're not comfortable with expressing really deep emotional pain or grief or memories or just really personal information in a group setting at all, much less in a group setting. And now you're basically obligating them to do that. And so it ended up being even more difficult and even more traumatizing for people who had already been traumatized and who had already lost loved ones and family members to the earthquake. And now they're having to rehash it, not only rehashing deeply personal emotions, but rehashing them in a group setting, which is not at all culturally what they believe in or what they're taught to do. So it's very important when you're talking about Western medicine, and I'm not trying to put down Western medicine at all. It's a wonderful thing. It saved lots of lives. But it's important that when you're dealing with Western medicine and you're dealing with other cultures and you're trying to combine Western medicine with other cultures, it's important to take into consideration those other cultures and to make sure that those cultures and the people that you're trying to treat with your Western medicine are also being respected as individuals and as individuals who are informed by the culture that they were raised in. And this is all part of something called cultural competency, which is what we're trying to do, which is something that we're trying to develop, where no one person is going to be completely aware of every culture and every nuance and every cultural idea from every country in the entire world. It's not possible. But the idea of cultural competency is not necessarily being competent in every culture. Or knowledgeable about every culture. It's just being knowledgeable about the fact that there are a vast variety of cultures and that people are very, very deeply informed by the culture that they come from, and that the way that they express their illness and the way that they speak to their doctor and the way that they describe their symptoms is going to be very much informed by their culture. And so it's important to keep that in mind when treating patients, so that you don't have a situation where you're actually putting the patient through more trauma or more pain than would otherwise be necessary, and you don't have situations where you're laughing at the patient, maybe not laughing at the patient, but laughing, or you're you're kind of brushing something that the patient is trying to tell you under the rug because you brush it off as not important or irrelevant, when in reality it might be very relevant. So that's the idea, and that's why it's so important when we talk about Western medicine, especially now that Western medicine is being utilized across the globe. It's very important that it be utilized correctly and that it be sensitive and understanding of the cultures that it's being utilized within. Thank you very much for your time and your attention, and I hope you enjoyed the speech.